first thing that I'm going to do before entering the room is wash my hands. I'm going to check the Cardex report. I'm going to finish the Braden Scale of Risk Assessment, and then I'm going to obtain a verbal report from the previous HCP and just ask any relevant or clarify any relevant health history information. All right, so as I enter into the room, I'm going to introduce myself to the patient, and I'm just going to ask permission for the, ask them if they're all right if I assess them.
Yes.
All right, and then the next thing that I'm going to do is just check the patient wristband. Perfect. And ensure that the head of the bed is at no more than a 10-degree angle. All right, perfect. So the first thing that I'm going to do is I'm going to assess or inspect and palpate the skin of the head, and I'm just going to be looking for any lesions, any rashes, any injuries, or any discoloration of the skin. So in the face, there are three primary things that I can look for. I can look for erythema, which is going to present as a red coloring across the face, and you can often see that very darkly on the lips if somebody has a darker skin tone. I'm going to assess for jaundice, which can be seen in the sclera, and also very well in the junction of the hard and the soft palate. And then I'm going to look for carotenemia, which you can see generally along the forehead. All right, so now that I've done my skin and PDS assessment, skin assessment, I'm going to look at the PDS. I'm going to assess for pallor cyanosis. I'm going to look for any edema and dehydration, and then I'm going to feel the scalp. Perfect, and some of these are encompassed within the skin assessment, and I'm just going to be palpating for any pore shape and also any tenderness. All right, perfect. So the next thing I'm going to do is assess for the cervical lymph nodes, and then I'm going to take the temporal artery, measuring it bilaterally, and this is typically found above the zygomatic arch and right anterior to the ears. And when I'm assessing that, I'm just going to assess for the strength of the pulse and also the equality of the pulse. I'm then going to move down to the neck. I'm going to again inspect and palpate the skin for any rashes, lesions, injuries, or any issues with the coloration. I'm gonna again assess for edema or any form of dehydration. And then I'm also going to check for the warmth of the skin. All right, perfect, excellent, great. And then as I do that, I'm just going to quickly ask the patient whether or not they have any issues with the rash, if they have any feelings of itchiness or irritation in their skin across their body. And normally I do this as I was assessing the head. Next thing I'm going to do is assess the carotids. This can be found anterior to the sternocleidomastoid, between that and the trachea. And with these guys, you want to be sure that you are not assessing at the same time. You're going to do one after the other. And you're also going to be assessing the force and the equality of both carotids. Next thing I'm going to do is assess the arms. So if you'd be able to lift your arms, thank you, sir. All right, perfect. And I'm going to inspect and palpate the skin. And then I'm going to inspect and palpate the brachial and the radial artery bilaterally. So the brachial can just be found here on the inside medial arm. Perfect, and I'm just going to be, for both the brachial and the radial, I'm going to be checking the strength and the equality and measuring bilaterally. Excellent. Next thing I'm going to do is just assess capillary refill. And I'm just going to assess the arms for equality or symmetry in temperature, just with the dorsa of my hand there, and also color. Excellent. Okay, and just to note that typical capillary refill, in order for it to be considered brisk, will need to be, sorry, my phone may have glitched a little bit there. In order for it to be brisk, the capillary refill has to occur within 2 seconds. All right, excellent. So the next thing I'm going to do is assess the chest and the abdomen. And while I'm doing this, I'm just going to want to maintain patient dignity. So I'm going to be looking at the chest. I'm going to be noting any irregularities that I may see. And this is true for the entire skin system, just taking note and recording any issues that I see in the skin. So I'm just going to assess and palpate, again, maintaining patient dignity and warmth. All right, so once I finish my chest assessment, typically this would be done with 2 people, but I don't have 2 people on hand. So I'm just going to do a turn of the patient onto their side, lifting up their knee, turning their arm over, and crossing them like so. They'll be up against the rail, which will be the single rail that I have up in this examination. Again, I'm going to inspect and palpate the back, just maintaining patient dignity and taking note of anything that I need to be aware of in this region, and not exposing too much area at once. Once I've assessed this region, I'm going to get the patient to turn back down. Excellent. And I'm going to start on the feet and the legs. All right, so again, maintaining patient dignity, I'm going to inspect and palpate the skin along the leg. I'm going to assess the leg on both sides for equality in symmetry, equality in color, and also equality in warmth. Then I'm going to take the femoral pulse, which you can find between the anterior superior iliac spine and the pubic symphysis. So for all of my femoral, so this is the femoral pulse that I'm going to be taking. For that pulse, I'm going to be measuring bilaterally, and I'm just going to be assessing again the strength and equality of the pulse. I'm going to do the same thing for the popliteal pulse, again maintaining patient dignity. And then this guy can just be found in the popliteal fossa, essentially medial. This is often very difficult to palpate. And then I'm going to take the posterior tibial, which I can find directly posterior to the medial malleolus, and then the dorsalis pedis, which you can find generally kind of medial and then the midline of the foot. You should usually assess this a little bit more lightly. And with each of these pulses, I'm going to take note of the equality of the pulse as well as the strength of the pulse, of course rating from a 0 to a 3. All right, so the next thing I'm going to do is check the capillary refill. Again, this has to be brisk. And at this point, I have concluded my examination. I'm going to cover up the patient and ensure that all of their linens are correct. And then I'm going to lower the head of the bed, or I'm going to lower the bed completely all the way down. I'm going to raise it to between a 30 and 45 degree angle. And then I am going to put all of the rails up except for one, just to ensure that patient safety. At this point, I'm going to thank the patient to indicate that my examination is complete.